Good morning, class. Today we want to talk to you about loop diuretics with emphasis on the drug furosemide. Furosemide was introduced to the market in 1966 under the brand name Lasix. Since its introduction by Sanofi, it has been placed on the World Health Organization's list of essential medicines. Furosemide is indicated for the treatment of hypertension and edema and is a first-line treatment in patients with congestive heart failure. It is also used in cirrhosis, renal impairment, nephrotic disorder, and in cerebral and pulmonary edema where rapid diuresis is required.
Alright, so furosemide is a loop diuretic, so it's going to have its action here on the loop of Henle. We have a picture of the nephron, and if we zoom in on the thick ascending segment of that loop, we'll find the NKCC pump, which that's the pump that furosemide is going to have its action on. So it's going to pump a sodium, a potassium, and a chloride, two chlorides, across and into the cell, and this is going to create a concentration gradient with potassium, making the levels go up in the cell. Over here we have the sodium potassium ATPase pump, which is also going to contribute to that concentration gradient of potassium, and it's going to pump one sodium out for every potassium in. So now that we have a high concentration gradient of potassium in the cell, it's able to passively diffuse out of the cell and create a positive gradient, which will help calcium and magnesium be paracellularly transported into the blood. So when we block this pump, we're going to have a high concentration of the solutes in the lumen, and we know that where sodium goes, water is going to follow, so that's going to cause our diuresis. This is also going to take away the high concentration of potassium inside the cell, which will disrupt the reabsorption of our calcium and magnesium, and they won't be able to be reabsorbed, so they will also be excreted.
Furosemide is available in several different forms, including an oral tablet, which is available in 20, 40, and 80 milligrams. It's available in an oral solution in 8 milligram per milliliter, which is available in 5 milliliters and 500 milliliters. It's also available in the strength of 10 milligrams per milliliter, which is available in 60 milliliters and 120 milliliters. It's available as an injection in 10 milligrams per milliliter, which is available in 2, 4, and 10 milliliters. The oral tablet can also be given by the sublingual route. Furosemide's onset of action of diuresis can be achieved in the oral route anywhere between 30 and 60 minutes when given orally. When giving intramuscularly, is about 30 minutes, and when giving IV, is about 5 minutes. Symptomatic improvement with acute pulmonary edema can be anywhere between 15 and 20 minutes. The peak effect of the oral tablet is anywhere between 1 to 2 hours, with the duration lasting between 6 to 8 hours. The IV duration is anywhere between 2 to 3 hours. And the bioavailability for the oral tablet is about 50%, which is also the same for the oral solution. The sublingual administration of an oral tablet has the bioavailability of about 60%. The half-life of furosemide with a normal renal function is anywhere between 30 minutes to 2 hours with normal renal function, and end-stage renal disease is about 9 hours. The protein binding of furosemide is anywhere between 91 and 99%, with primarily being bound to albumin.
A small fraction of furosemide is metabolized in the liver. The majority of the drug is excreted via the kidneys, 50% for oral administration and 80% for IV, through glomerular filtration and proximal tubular secretion. The remainder of the drug is excreted in the feces. Adverse effects of furosemide can be summed into 3 main categories. The first is diuresis-related. Urinary frequency, acute and orthostatic hypotensive episodes, dizziness, rapid fluid loss, increased cholesterol and triglycerides, hyperglycemia, hyperuricemia, hypocalcemia, hypokalemia, hypomagnesemia, and hyponatremia, metabolic alkalosis and increases in BUN and serum creatinine. Second is ototoxicity, which results in tinnitus and hearing loss, both reversible and irreversible. Finally, there's hypersensitivity reactions, which are rare cases or allergic reactions have been reported with furosemide ranging from a skin rash to severe anaphylactic reactions. It contains a sulfur group in its structure that may cause reactions in patients with a sulfa allergy. Other more rare side effects include dermatologic reactions and hematologic disturbances.
Some of the main drug interactions that pharmacists should be aware of while taking Lasix are aminoglycosides, some examples such as gentamicin and tobramycin, and also most chemotherapeutic agents. These drugs will increase the risk of nephro and ototoxicity. Taking lithium will also increase the risk of a lithium toxicity. NSAIDs may cause a decrease in the loop diuretic activity, and probenecid will competitively inhibit the tubular secretion of the diuretic. Some patient education counseling points you should tell your patient is to take the medication on an empty stomach. It is also important to take it in the morning and to avoid taking it at night. This will prevent the patient from being woken up through the night to go to the bathroom, which can increase the risk of falls, primarily in the elderly. You will want to monitor your blood pressure regularly while on this medication. Lasix is a pregnancy category C, and it is excreted in the breast milk. You should talk to your doctor before considering breastfeeding. While on this medication, you are at an increased risk for sunburns, so take caution by wearing sunscreen, or you can always wear a big floppy hat.